Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Wynn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to this episode of the Healthcare Connections podcast. I am your host, Jeremy Wynn, the Director of Sales here at Healthcare Compliance Pros. Excited to introduce a new guest to you today. We've got Ericka Adler. She is a shareholder and the leader of the healthcare group at Roetzel Andress law firm. Ericka, welcome to the show.
Well, thanks for having me.
Absolutely. I'd love for the audience to get to know you a little bit. If you don't mind sharing a brief introduction, your background, kind of your journey to get you to where you're at today.
Sure. So I've been practicing health law for about 30 years, since the beginning of time when healthcare became a thing. And we represent thousands of physicians and other healthcare practitioners, as well as their entities across the country. And we work with other types of healthcare facilities as well. And basically what we do is we represent our clients from the very beginning of their process, whether they're just forming a new practice or just getting started. We help them grow and expand, and then we help them sell and, through their M&A process and retirement or whatever that may hold for them. So we're the full life cycle for our healthcare clients, and we're also full service for our healthcare clients. So I'm a regulatory and transactional healthcare lawyer. And so there's really no aspect of healthcare that we don't get to deal with on a daily basis.
Absolutely. I love that. And that's going to be the topic we focus on today from a high level. But before we jump into that, I also wanted to mention to the audience that you have your own podcast,
I
the
do.
Health Law Hotspot. Yeah, tell us just
That's right.
briefly about the podcast, because I think it's a great one for those that are listening to.
Yeah, so the Health Law Hotspot is really our target audience, our physicians, dentists, and other healthcare practitioners. And really, what we try and do is do little segments on the different issues that are coming up day to day in our practice. Whether it's, what should be in your LOI? How do you fire someone? What is a new thing coming out about non-compete? So just the questions that our clients are asking us or the challenges we're facing. And it's been out there for a few years. And it's actually hopefully really helpful to a lot of different people in the healthcare industry, and hopefully you'll check it out.
Love it. Okay, I highly recommend it. So let's jump into this. So we want to talk about, again, you kind of outlined what you do there, with your healthcare group, and I want to cover that at a high level. It would be impossible to get to the depth that's probably required for each of these topics, but I wanted to talk about starting, growing, or preparing to sell a practice, and looking at that from the perspective of compliance. And so,
Sure.
first topic in question, let's start at the beginning. Starting a practice. What are some of the first steps that an organization needs to take that you recommend as they're beginning to build out their compliance program?
Well, I think one of the first things that you come across in terms of compliance are the forms that kind of govern your practice, right? What are you having your patient sign? What kind of consent forms? Are you complying with the HIPAA notice requirements? Are you having your new vendor sign business associate agreements? Are you giving good faith estimates? So, what we like to do is meet with our clients, talk about the kind of practice they're creating, if it's cash based or something else, and what type of documents are needed, which can vary depending on the type of practice, right? So, if you're going to be seeing patients that have Medicare coverage or commercial insurance, your documents might be a little bit different than if you're doing a direct primary care, right? So,
Yeah.
you really need to tailor that compliance approach for the particular practice. But of course, for all practices, there are some underlying requirements. So just making sure, a lot of clients like to rely on forms they might be getting from friends or colleagues, and who knows how old they are, or using, GPT to kind of print out
Yep.
some stuff. And, it's at your own risk. You kind of get what you pay for, right? So we do want to make sure that whatever forms are complying with state and federal law and that you're protected really, because that's really kind of a silly thing to get in trouble for, right? Because you didn't get
Right.
good forms.
Yeah, I agree. And that sounds like such a basic thing, but I can tell you is we have groups come to us that are looking to enhance their compliance program and put a software in place to help them, manage it. A lot of time we always start with policies, procedures. We want to see, do you have something in place now? If not, let's help you start there. And it's amazing how many people don't have even those basic forms when they come to a group like us. So it's,
Right,
again, seems like a basic thing, but it is so critical and such a foundational
right,
step to take as you're starting
right.
out.
Yeah, and there's different parts of compliance. I mean, there's the healthcare piece, but also can you keep a credit card on file? I mean, you got to look at your state law, So there's a lot of different aspects to it. And what I would say is that you have to look, you have to be familiar with what your practice's goals are and what you're going to do. So if you're billing commercial insurance, do you have a good billing team in place? If you're, if you're, depending on what you're going to do, if you're doing like, some kind of hybrid concierge or something, have you looked at the law? Are you structured properly? So
Yeah.
perhaps like the first basic step is to make sure that you actually have a good team in place, right? Are you getting advice from somebody who knows what they're doing? Are you, like I said, are you printing off the internet? Are you kind of finding out the right answers to make sure that you're doing what's required for you? And that includes, working with vendors who are HIPAA compliant or working with,
Yep.
people who are knowledgeable and have experience and not cutting corners. And it's expensive to start a new healthcare business, and I understand wanting to be efficient, cost efficient, right? But sometimes cutting corners is what gets you into compliance concerns. So
Correct, and it can lead to sometimes, unfortunately, the end of a practice if
absolutely.
they're too daunting or too big. So, yeah, I love that. So, starting a practice, make sure you got the right forms, the right people giving you insights, and the right team around you, and the right setup and structure when it comes to ownership. All critical things to be compliant. So, let's move into growth mode. So after you've got kind of foundational pieces, you help a lot of groups as they're growing. What are some of the challenges in compliance that start to come as a group grows, matures, maybe moves into a new state from where they started, and now
Right.
they're looking at multi-state situations. Talk about some of the things that you really have to watch as you grow.
Right. So when you're first setting up your practice, and I didn't really touch upon this, but obviously you want to make sure you're choosing a right entity for the state you're in and that the people are licensed if required by the particular state. Not all states require that, right?
Yeah.
And that you're choosing your correct, tax selection, etc. So
Yeah.
this is important because, as you spread to additional states, you then need to look, well, what do these states require? Can I qualify my current entity in that state, or do all the owners need to be licensed in that state? Maybe one state requires licensure of the owners, one state doesn't. So you're going to be looking at those kinds of things. The other thing I'll mention is, and we're not going to really go into detail here, is that from a healthcare perspective, whatever you're doing in your practice needs to always, if you're including federal patients, comply with like Stark and anti-kickback. So making sure you have the right policies, but for example, your compensation formula might need to be set up to comply with Stark, right? So as you grow and expand, you may not be covered by these laws, but you may become covered. So just growing and expanding without rethinking what your needs may be and what healthcare issues exist is something that you shouldn't do. You should constantly be talking to your team members to say, hey, we've added 5 physicians. Now we're doing x-rays. So do I have to worry about anything new? Yeah, you do actually, right? And so, and what you come up with may work perfectly in the state you started out with, right? But if you go into a new state, in addition to looking at what the federal laws may require, there may be some state requirements there. You may need to certify a particular practice with a certain government body, right? Or the equipment that you're using. You may need to think about what being in that new state means from a healthcare perspective. They may have their own anti-kickback statutes that don't allow you to do something in that particular state that you could do in the other state. So when we're thinking about expansion, other than the normal all things, a new lease, right? Hiring new
Right.
people, making
Right.
sure you have great contracts, making sure the forms that you and I talked about are meeting the new state's requirements, because some states do have particular requirements, whether it's privacy requirements or telemedicine requirements, whatever it is that you're doing, direct primary care or concierge, California, for example. If you're going into California, it's going to be very different than other states. They don't have the Knox-Keene statute there. So it's looking at everything about your practice
Yep.
and thinking, what does this new state require of me? And it can be as basic as, registering your entity with the state
Yep.
versus redoing your document. So
Correct.
it's hard to say exactly, but you just don't know without looking at very fact specific information.
Absolutely. One of the common ones that we see as groups grow is they don't realize that there are some states that require, when it comes to just training, again, think about a thing people understand in compliance. Everybody needs to be trained on certain things. But when it comes to training, some states require some addendums, and they maybe need to go a little bit farther in your OSHA trainings. Bloodborne pathogens
Right.
might look different in one state than another. And so there's all these little things that you don't know, unless you're relying and asking the right people that have done it and have
Right.
that
Right.
experience. And it's so important so that you can stay out of
Yeah.
trouble.
And it shouldn't be too overwhelming. I mean, you can find this information is available. Often a state medical society can
Yep.
kind of point you in the right direction for, requirements. But even like there's sometimes random things like I'm sitting here in Chicago and in Illinois. In Chicago, we have a requirement about sexual harassment training if you
Right.
have even one employee, right?
Yeah.
Well, if you're not doing that and then you get sued for sexual harassment, which by the way, happens quite a lot in, practices,
Yeah.
you're going to be in trouble. So it's those little one-off things also that you're not prepared for. So you can't just think about the healthcare business aspects. It's a business, right? It is sometimes you have to pay certain taxes in certain states that you didn't in others. If you're
Yeah.
selling products in your office, right? So there's so much to think about, and you can't just assume it worked here, so it's going to work in the next state as well, right? You have to think about all of these things.
Absolutely. Love that. Let's move to preparing to sell. I think this one's could be really interesting. As you've helped a lot of groups over the years, go through a diligence process as they're getting ready to sell. What are some things that you see that buyers are looking for, when it comes to compliance? What do they want to see? What red flags are they seeking out as they're going through the diligence process?
Right. I think that, as your practice grows, you should be putting into place and obviously, if you're looking to sell, you probably have built something worth selling, right? So part of the ongoing process as you grow should be putting into place compliance procedures and processes, whether that's your annual training for HIPAA compliance, your HIPAA policies, also regular auditing if you're billing commercial or, Medicare payor. So buyers are looking to see, have you done those things? What do those policies and procedures look like, right? Have you ever been audited internally, just yourself, to make sure you're doing everything right? Have you ever been externally audited? So
Yeah.
obviously they're going to be looking, when we work with a practice in terms of trying to prepare to sell, we look at everything. We want to know, are their contracts written properly? Are they complying with Stark
Yeah.
in their compensation? What are their policies on kickbacks? And are people following them? Are they meeting incident two requirements for billing?
Yeah.
Are they properly classifying employees versus contractors? So a buyer is looking at all these things. None of these things necessarily are deal killers, right? But you should do your own compliance ahead of time so you're able to correct perhaps some of the things, right, that occurred hopefully well ahead of the time you want to sell, because you don't want to find out when the buyer is finding out, right? But it can affect your purchase price
Yes.
depending on what is found out. It can delay the transaction. If it's a significant healthcare issue, it can require a self-disclosure to the OIG, a refund of money, rebilling, et cetera. So there can be a big impact depending on what's discovered. So, what we like to do is kind of provide a diligence list to our clients and say, hey,
Yep.
this is what they're going to be asking you for. And we like to kind of dive in if we can. Now, understandably, not everybody wants that. They're like, we're going to go through it in a month with them. We'll just do it with them and we'll deal with. That's fine.
Yeah.
And honestly, a month before doesn't really give us much time to do anything except to find really egregious things. So ideally, you have a good team the whole the whole time, right? So
Right.
you should be talking about these things all along, and you should be ready by the time a deal comes along and
Correct.
feel confident about your documents, how you're doing things, your compliance. And I'm not, even the best practices, of course, you know, there's issues that come up, right? You can't avoid it, but you can be in better shape versus, versus worse shape, right? And you certainly don't want anything that someone discovers to really be something that kills a deal or that gets you in trouble, from a regulatory standpoint. So I think it's just kind of naturally follows along with what you and I have talked about, having that team in place, looking at the financials, looking at the compliance, looking at the documents that you're using, and those kinds of issues well ahead of time.
Absolutely. I think somebody, and I cannot remember who this was, it was a guest though on the podcast, said that the advice that they give a lot of their clients is set up your compliance program and run your practice as if you're planning to sell it, whether you are or not. Because if you're doing that, it'll get you focused in on the things that matter and make sure you've got everything buttoned up. And it's going to make you a better practice, a more profitable practice now. But again, even if you're not looking to sell in the near term, with that mindset, operationally, you just become better. And then
Yeah.
if that day comes, it's such a smooth process. So I always
Yeah.
thought
I
that was
mean,
great advice.
yeah, that is really good advice. I mean, unfortunately, sometimes, the lawyers and the accountants and other consultants help get the practice started. And then once they have the forms and the basic setup, they tend to like not want to spend money and to just do things on their own. And so
Yeah,
5 years later, what does that look like? Were people classified properly? We wrote you a compliance plan. Did you look at it?
right.
Right?
Yeah,
Compliance plans are living, breathing documents. You got to think of them as something that grows with your practice, right? You need to constantly be reviewing, training, modifying. So if it's been sitting on your shelf the whole time, that didn't do you much good, right?
yeah,
But physicians and other healthcare practitioners they're busy. I mean, the amount of time they have to really devote to this is not much, right? So it's understandable they get buried and don't have time to think about this, but that's great advice. And everybody really just has to try and do their best to kind of follow that type of guideline to really always be as much in compliance as possible.
yep, yeah. There was I've got several friends in the private equity space, and two things that they told me recently. One was I think for the calendar year 2025 that when deals fell apart during last year, about 70% of the reason that deals fell apart came to compliance. And so he was emphasizing again just how important it is to just always have that on top of mind because it will allow a transaction to happen smooth, to move quicker. And he even said a lot of times when they're looking at purchasing a group, when they go through a compliance diligence process, compliance is one of the areas where they look for reasons to discount the purchase price. And
Oh
so
yeah,
so if you're buttoned up, it actually can allow that multiple that you wanted to stay right where it is. And so again, it may not add a multiple, but a lot of times it can protect your multiple. And so,
right.
so I thought that was just really good insight from somebody that's doing this day in, day out and looking
Yeah.
to purchase practices. So yeah, love that. I
Yeah.
think it's so wise to just stay on top of it. Don't put something in place and then leave it on the shelf for 3 years and hope that it's going to help you when that time comes. So I love that.
Yeah,
Um,
absolutely. I would say one of the biggest reasons though I see prac deals fail, it's usually a compliance issue related mostly to billing issues,
billing,
right?
yep, definitely.
Um, and so I do think having that audit internally, and it's not expensive, every 6 months, every year done, and using certified coders and billers really make the difference. You can't and don't have the same people doing your billing audit themselves because
Yes,
that doesn't work. But to me, that is really, the biggest issue. And the other financial aspect would be that they hold back money in case there's another audit or something like that. And so it's really, you can get your money, but it might be like a big delay, right, in getting the money if they're not confident about how good a job you did. And,
yes,
I think people just get kind of comfortable with, the people in their office that have been doing the job for a long time. They trust them, but, you've got to just stay on top of everything all the time. And but I agree with that advice. It really can kill a deal.
yeah, absolutely. So, Ericka, for those that are listening, again, no matter where they are along their journey, maybe they are just starting out, or they're like saying it's time to grow, or I'm ready to sell, and they want to reach out to you and potentially work with you. What's the best way to connect?
Well, you can just shoot me an email. Probably the easiest way. It's eadler@ralaw.com, and always happy to answer any questions anyone has.
Perfect. Okay, Ericka, thank you so much. This was really good insight. We'll have to do another episode and dive deeper on some of these topics, because I know today's goal was to kind of high level, since you can only talk so much in about 20 minutes. But
Yeah.
really good information. I really appreciate it. Thank you so much for
My
doing that.
pleasure. Thanks for having me.
Absolutely.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.